the heart-brain connection, because in a sense we all are really dealing with some of the same kind of problems. The vessels just happen to be in one organ system versus another. So I'm going to mention, first of all, some of my investigator involvements with various companies, some lectureships, a bit of consulting, some of my grant funding, and salary support, for which I'm very grateful. I don't have any stock or equity interests, and I never created a patent that someone then stole from me. So I thought what I would first do is a little cross-cultural education and talk about small vessel disease in the brain, because that's something that's become very fascinating to me in the last decade or two. And it's very important in association with cognitive impairment through direct injury to brain regions, but also because it affects the clearance of a substance called amyloid, which some of you will know can happen in the heart. It's called amyloidosis. And when it happens in the brain, it's called Alzheimer's disease. So clearance problems and aging of the vessels contributes to the development of Alzheimer's disease. Maybe one of the reasons that aging is one of the most potent risk factors for Alzheimer's disease of the typical kind. So what I wanted to do is illustrate the importance of cardiovascular diseases, including obvious things like hypertension, heart attack, hyperperfusion syndromes, congestive heart failure, for example, particularly atrial fibrillation, and how they're kind of increasingly being recognized as very important with respect to brain health and cognitive impairment. And I needn't tell this audience that vigorous management of vascular risk factors is hugely important, not just for the heart, but for the brain. And everything is exercise, 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 and it'll give you your brain and your body a better chance. So I wanted to start with this little picture, which is of the brain's vascular network. Looking up, I've heard these different claims about how many miles are represented by the vasculature. And I thought the comment that there are 400 miles of capillary, if you did them end-to-end, of capillary network in the brain seemed like it couldn't be possible. 400 miles. So I went searching, and you can't find much on this, but there's the Franklin Institute has some statistics on this, and I'm not sure. It's a sort of education and research institute. And the number that they came up with was so unbelievable that it can't be right. It said that there's 100,000 miles of vasculature in the human body, in the adult human body. So I guess the brain has maybe 40% of that. That includes capillaries, veins, arterioles, the whole works. But there's a lot of vessel. And in the last several years, we've begun to try to define what we mean by the different diseases that affect the small vessels of the brain. There have been some consensus get-togethers so that we're all talking about the same thing. And it has multiple faces, and I thought I would just take you through a whirlwind tour of what some of these are and what they look like, because you're going to see them in a lot of your patients with heart disease, congestive heart failure, with various valve diseases, etc. And just that you don't usually do an MR of your patient's brains, but maybe you should, maybe you shouldn't. So here's one example. If I can get the, how do I get this laser to work? Where's the laser? Is there a laser? Oh, that's the laser. Oh, man, this really is, this is a serious laser. This looks like a surgical laser. Okay. I will try not to poke anybody. Okay. So I guess we'll have to do it on this screen. So this is what we mean by white matter disease, but this would be what a recent small lacunar infarct looks like. And it may or may not turn into a hole. That's something that it doesn't always happen. It may be a partial infarct. But that would be around the ventricle here. This is part of the brain. That would be a recent infarct. This would be what's called a white matter hyperintensity. It means it doesn't have a hole. This is if that cavitates, you actually have a hole in the brain. There's some new understanding, because we can see them better, of what we call the perivascular spaces, shown here along their venules in the brain. This is again looking at the ventricles, and you see these radiating out. These may be important because that's also part of the pathway for exiting amyloid from the brain in a kind of garbage removal system, which happens particularly during deep sleep, which is why sleep is so important, because during deep sleep your brain is on garbage patrol, and it's getting rid of various proteins, including amyloid. So if you don't sleep, or if your vessels are not healthy enough to do that job, then you will accumulate amyloid as you get older. Then there are microbeads where you get leakage of red blood cells out of the arteries that are getting weakened by usually amyloid, but also you can have it from hypertension. And then this is the most interesting recent development with the use of 3T scanning, high-resolution 3T scanning. This is a close-up of a sulcus in the brain, and you see this little ditzel here, which would be about 1 millimeter. It's a microinfarct. We can now see these at 3T. You have to be a little on the OCD in order to look for them, because they could be everywhere, but it's one of the ways that atrial fibrillation may be affecting cognition. Our group has tried to take seriously all these different types of small vessel disease, as well as actual focal infarcts, and at the same time measure the thickness of the cortex and the different brain volumes. And this just kind of shows you a pipeline which tries to be comprehensive. Many of the pipelines that are used in the field of Alzheimer's disease only look at atrophy, and there's this inconvenient truth that there's a lot of white matter disease in people with Alzheimer's, with Parkinson's, with whatever you want to call it, as they age, and it's kind of, you try to ignore it because it messes up your pipeline. We've taken the approach that you have to embrace and measure all these things, because that's telling you what really is going on in the brain, and some of the, what's left after you remove all that is what we call the brain parenchyma. I'll show you more about what some of these things mean, which have to do with thickening of the veins. So what you are mostly aware of is that there's arterial small vessel disease, where you get collagenesis and hyalinosis eventually in any organ. But in the brain, it sort of looks like this. It obliterates. You get increased vascular resistance, decreased autoregulation, which is very important in the brain, because in the brain, we automatically attune our pressure to whatever is coming in order to maximize brain flow. But if you have hypertension, you start to set that too high, and you can cause damage to the brain because of decreased in autoregulation. There's also endothelial changes, blood-brain barrier leakage, and these perivascular changes, which are actually very important because that's where the amyloid and the arbitrary garbage is getting out along the perivascular spaces, shown here. So when you have blockage of those arterioles, you get what are called lacunes, little lacunes, silent lacunes so-called, but you also can show that these lacunes are associated with increased arterial stiffness, carotid femoral, pulse wave velocity, central pulse pressure, pulsatility index, are all sort of associated with these lesions. So it has to do with putting extra stress on the brain, and therefore maybe affecting the vessels. Diabetes will also do this. So you end up with these hyalinosed arteries, arterioles, and little holes. That's not the whole thing, though, because you may not have to actually occlude a vessel. You can also just get old and keep remodeling the vessel, just like you may get remodeling in the carotid artery or the vertebral artery or whatever. And this shows you what an arteriole in your brain should look like when it's penetrating in from the surface toward the ventricle. And that's hopefully what everybody in this room looks like in terms of their artery. But as you get older, they start to twist. Sometimes they twist so much and turn that you actually do not have any circulation. You may as well have it occluded. So that is why you can have elderly people who have no vascular risk factors that you would recognize, other than age, can end up with holes in their brain and perfusion problems. This is an example of what a good artery would look like, again, penetrating from the surface down. this is what an artery looks like when you have amyloid along it. So the other important bit of information I'd like to share with you is that amyloid in the brain gets out along, escapes from the brain along the arteries, primarily, or the other vessels as well. And in so doing, it can actually damage those arteries, and it can also be associated with ischemic change as well as bleeding. So that is what an artery looks like that has a lot of amyloid around it. If you look at the peel surface of the brain, this is showing the peel, all the peel arterial supply, heavily interconnected network of vessels, and these like blotches here and there are where you've got amyloid deposits, and you see this rather ugly, what's supposed to be nice, clean-looking surface showing the effects of amyloid. So amyloid is actually a vascular toxin, as well as a cellular toxin in other respects. May be there as an acute phase reactant against infections as one of its duties and why it's there. But it can end up damaging the brain. And when you have amyloid angiopathy, this is how you may present to the emergency department. This was a businessman who started bumping into things, and his coworkers thought that maybe he was drunk. They eventually got him to the hospital. They did what they do now, which is they take a scan, and here's his big occipital hemorrhage on the left side. He was talking a little funny. He was like aphasic. He couldn't calculate. He had a field defect. And he eventually, after a number of years, he partly recovered from this. He eventually developed what often happens with amyloid angiopathy. He developed the parenchymal form of amyloid, which is Alzheimer's disease. So Alzheimer's pathology can deposit in fibrillar plaques, but it can also be along the vessels. So these are the perivascular spaces that I mentioned, and when you look at scans, here's MR scans, and you see these holes. A lot of people say those are strokes. Well, they're not necessarily, especially around the deep part of the brain. They're just enlarged spaces around the arterioles. And they, some of it can be sort of naturally there, but they all also may reflect some changes in the vessels that are going on over time. This shows you some other examples. You can see them in longitudinal perspective. So what's interesting is that when you see the perivascular spaces in these areas, that's where you're going to start to see the amyloidosis and amyloid angiopathy, and that's what this gentleman had when he had that bleed. But deep in the basal ganglia area, deep in the brain with the thalamus and the basal ganglias, that's associated with hypertension. So that's where you get a lot of pounding going on, whereas in the white matter, there's a kind of a reduction in the pulsatility, but that's where you can get these perivascular spaces. They're thought that they may actually, through the pulsations, it might be helping to get amyloid out of the brain. Now, what everybody, almost everyone has after age 65 is a little bit of what we call white matter disease. This shows you different amounts of white matter change and what it looks like on a brain. Be not uncommon to see this in a 65 or a 70-year-old, who's had a heart attack, and certainly stroke patients. We see it a lot. And this just shows you increasing amounts. When you get to have this amount, you will have a bit of a syndrome where you'll be slowed in your thinking. You have some gait and balance problems. You may have a little bit of irritability and stubbornness. And you're kind of undermotivated, so it's got a bit of a clinical syndrome. This is called periventricular white matter hyperintensity. Now, it turns out that these hyperintensities actually co-localize with the deep penetrating venules of the brain, which have been totally under the radar, and I'm sure in the heart, too, you talk about congestive heart failure and arterial supply, but there's also a venous system in the heart, and diseases of the veins can be part of the story that develops in certain types of congestive heart failure, but certainly in the brain, there's a kind of venous insufficiency syndrome that this periventricular white matter disease represents. The pathology associated with this, if you take a white matter hyperintensity postmortem, is actually thickening of the deep penetrating venules. So it's actually a veno-occlusive disease, which again may increase vascular resistance to the incoming blood. It leads to leakage, and in fact, that white matter hyperintensity is probably leakage, vasogenic edema. So these are, again, this is again the mention of the microinfarcts. This is showing it in the setting of a couple of brain slices. You practically need a magnifying glass, but there's a little ditzel there. This is on T1. These are microinfarcts, and you can see them scattered around the cortex, most often associated with some sort of embolic source, particularly AFib, but you can also see in amyloid angiopathy small infarcts as well in the cortex. And the likelihood of people being demented with microinfarcts at autopsy, as shown here, it is, yes, you're more likely to be demented. In fact, these little ditzels are relevant, and the more you have, the worse it is. Now, with respect to vascular risk factors, this audience knows all of these. You might not know that homocysteine, perhaps you do, it's injurious to vasculature, so it is associated with more of the white matter disease and vascular brain disease. But the age is still, I think, super important. Hypertension, really bad for the brain. And physical activity is inactivity is really bad for the brain, as is sleep apnea, because it's interfering with that cyclic removal in deep sleep of the garbage collected during the previous day, including amyloid, as well as it's causing jolts of adrenaline when you're apneic that contributes to hypertension, stroke, Alzheimer's disease, and heart attack. So this is to show you that midlife blood pressure is increased. It increases the risk that you're going to have dementia in later age. And it's not always just vascular dementia. It can be Alzheimer's disease. These are the sorts of numbers, 3 times or 5 times the risk when you have untreated hypertension in midlife. I think we're seeing less of that now, but it's still a worry. And I just wanted to show you when the brain has Alzheimer's disease, there's amyloidosis and tauopathy in the brain. Those are the plaques and the tangles. It's not the whole brain that shrinks. There's actually a pattern. There's a topographical pattern. That's why doing brain studies is a little more interesting perhaps than doing heart studies, because we've got these functional networks, we've got regions that mean different things, and so you can spend a whole lifetime just kind of trying to understand what these different centers and their injury may do to a person's ability to speak or to understand or to think and to reason. So this shows you the signature pattern of thinning in Alzheimer's disease. On the right side, on the lateral surface, medial surface, these are like the key signature areas that thin because the brain is being injured and destroyed by the Alzheimer process. So now look at blood pressure, cholesterol, and glucose, which were studied in an elderly population where they were looking at blood pressure that wasn't too high because they treated some of those, but people who had blood pressure when they first came in. And they looked at the cortical thinning using these modern methods that we have. And it's actually almost the same areas that are prime areas for attack in Alzheimer's disease. Cholesterol was a little bit different, but some are the same. And glucose seemed to involve the anterior cingulate and the hippocampal area slightly different. How many minutes do I have? Only a couple more minutes. Oh my God, jeez. I'm just getting there. Okay. All right, so coronary artery disease. How many of you know that people show cognitive decline in significant amounts? Verbal memory is often poorer in people with heart disease, and verbal memory performance, if you follow people, decline. And this is showing something called mild cognitive impairment with cardiac disease. This is where you've got memory problems, but you're still functioning. It increases in people who have cardiac disease. And this is just saying the same thing, that there's some people who develop cognitive problems, and they're more likely to do so if they have that white matter disease or if they have small hippocampal volumes. The hippocampus is another area that's attractive to Alzheimer's disease, and that's what we can now do. We can isolate the hippocampus and measure it. Hemodynamics, I don't have time to go into this, but basically the lower your cardiac output, the more stress the brain is under in terms of its day-to-day functioning, and you can show that you get lower brain volumes in association with cardiac output. It's also shown here with cardiac index in the Framingham study. that you're showing greater chance of becoming demented, and also now they've got brain volumes to show that your brain volumes are affected. Not many of you may know that the cholinesterase inhibitors may actually be cardioprotective. And in some rat models of congestive heart failure, donepezil, which is the typical drug that's used in Alzheimer's disease, is actually protective because of its effects on the vagal nerve. And although the cholinesterase inhibitors have this reputation of being bad for your heart, because people come in with if they have bradycardia, they shouldn't be on them, with syncope, etc. There was a study done in Sweden showing that the cholinesterase inhibitors were associated with a reduced likelihood of heart attack and death, partly because of some vagal protection. So AFib is a whole topic on its own. We're getting more and more interested in this because it's associated with cognitive impairment. This is just kind of showing that AFib always favors being impaired. I don't have time to go into the very interesting work recently that's coming along with respect to treatment of embolic strokes of uncertain source, looking now at left atrial enlargement, which is a big risk factor for for stroke, for embolic stroke. And it's reduced by the use of anticoagulants as opposed to aspirin through a mechanism that's not fully understood, but it looks like an abnormal atrium is a bad thing to have, especially with atrial fibrillation. It increases your chances of stroke. There's now a study that's going to be looking at that to really nail it down and to see whether it's beneficial to have a OAC as opposed to aspirin in people who may have atrial, they call it atrial myopathy, cardiomyopathy, with or without atrial fibrillation. Finally, patent form of valley, I needn't tell you that that's become very interesting just in the last few years. We used to advise against closure because of the complications, whereas now it looks like the new techniques are improving your chances of not having a stroke if you have modern closure in the last few years. So now it's becoming a little more complex in terms of when you say yes or no to having your patent form of valley closed. So this is sort of summarizing some of the data to date with who should or should not have this, because it's now much more of an option than it was even a couple of years ago. Finally, fitness and brain health. I needn't tell you that this is important. This was just an interesting study that looked at physical activity over the decades in elderly ladies in their 80s, and they found that their performance on cognitive tests was associated with how much physical activity they had throughout their lifespan, but particularly in the teenage years. It was protective. So we have a problem in our society right now because they're all at home sitting in front of their computers or texting as we speak. Finally, there's marks. Well, actually, just recently, maybe the most interesting thing is that the Framingham study just published some data on walking, even light physical activity, saying that in a population they studied over a number of years, if you walk if you have 7,500 steps a day, your brain is bigger than if you don't. So in conclusions, I think we all, both the neurologists and the cardiologists, the heartologists, really need to be trying to understand these relationships a lot more. We are all part of a vascular system, whether we like it or not, and it's aging. You have to understand cerebral small vessel disease, understand that what is most commonly seen is actually a venous disease, where they have this, at least in people who are well treated for hypertension over the years. It's the venous disease now that we're seeing more and more, and 95% of people over the age of 65 have some degree of small vessel disease showing up as hyperintensities. These covert lesions need attention. We now have to be much more aware of the microinfarcts, which may be an indication that a person has AFib. We now have ways of monitoring and to find that and to treat that. And vascular risk factors are turning out to be of great interest, particularly now physical inactivity and the need to make sure that everybody is moving. So fine, I think that's it. Let me just see. This is just some acknowledgements and my staff and Sunnybrook. It's up north there in case you didn't know. Thank you.